So this is a very specific condition. You'll have children who are presenting with foul-smelling discharge from only one nostril. Whenever there is a unilateral symptom, think of a foreign body. Whenever the child is having one red eye or one nostril giving foul discharge, think of foreign body. This is the gold standard tactic for this. If he or she was having any kind of infection, you would have a bilateral nasal discharge. If there was bilateral maxillary sinusitis, both his nostrils would be giving a discharge. It would not be as foul smelling because whenever a foreign body is lodged, it causes kind of a putrefaction inside and it leads to a foul smell. In nasal polyp, again, there will be congestion. Unilateral congestion can be there in a nasal polyp, but then again, the discharge would not be foul smelling. It will be giving out mucoid. And yeah, so if there's a septal hematoma, you will be seeing there's a septal hematoma present inside the child's nares, and if even if it is unilateral, it is blocking, it will again cause a clear discharge. Okay, and there will be pain present there, and there will also be a history of some sort of trauma or some sort of operative procedure that is being done. Okay, and then again, if there's a nasal tumor, there'll be bleeding of some sorts, or that is what you'll be seeing. It usually won't be that painful, or not there would be a foul smell discharge. Foul smelling discharge is the buzzword for your foreign body.
Thanks for watching. Please give a thumbs up and subscribe for more.